Hello, and welcome to today's lecture on peripheral neuropathy. In this session, we will explore the intricate details of peripheral neuropathy, a condition that affects the nerves outside of the brain and spinal cord. We will cover its clinical manifestations, emphasizing the diverse symptoms patients may experience. Furthermore, we will discuss the diagnostic approaches utilized to confirm the presence of peripheral neuropathy and the various treatment options available, including both traditional and cutting-edge therapies. Prepare to embark on an enlightening exploration of the captivating field of neurology. One common cause of peripheral neuropathy is diabetes, which can result in nerve damage due to high blood sugar levels over time. Other causes include autoimmune disorders, infections, vitamin deficiencies, and certain medications. The symptoms of peripheral neuropathy can vary greatly, but often include numbness, tingling, pain, and weakness in the affected areas. Diagnosis typically involves a thorough medical history, physical examination, and nerve conduction tests. Treatment approaches may include addressing the underlying cause, managing symptoms, and providing supportive care to improve quality of life. The clinical presentation of peripheral neuropathy varies depending on the specific nerves involved and their corresponding functions. Sensory neuropathy may lead to symptoms such as numbness, tingling, or burning sensations in the affected areas. Motor neuropathy can result in muscle weakness, atrophy, and impaired coordination. Autonomic neuropathy may manifest as abnormalities in blood pressure, heart rate, gastrointestinal function, and urinary control. Accurate diagnosis of peripheral neuropathy is crucial for effective management. The diagnostic process typically involves a thorough medical history, physical examination, and various specialized tests. Nerve conduction studies and electromyography can assess nerve conduction velocity and detect any abnormalities. Additionally, imaging techniques like magnetic resonance imaging, MRI, may be employed to identify potential compressions or structural abnormalities. One of the most debilitating consequences of peripheral neuropathy is neuropathic pain, which is characterized by spontaneous and chronic pain sensations. This type of pain arises from the dysfunction or injury to the nerves themselves, rather than from external stimuli. Understanding the mechanisms involved in neuropathic pain can help guide the selection of appropriate treatment modalities. In the treatment of peripheral neuropathy, our primary goals are to alleviate symptoms, slow down the progression of the condition, and enhance the overall quality of life for patients. We employ various treatment approaches to achieve these goals. Pharmacotherapy, which involves the use of medications, plays a crucial role in managing peripheral neuropathy. Analgesics, which are pain-relieving medications, antidepressants, and anticonvulsants are commonly prescribed to control pain and regulate nerve activity. Alongside medications, we also incorporate physical therapy, occupational therapy, and nerve stimulation techniques as part of the treatment plan. These therapies help in enhancing nerve function and promoting functional recovery. Autoimmune and inflammatory neuropathies are a collection of disorders affecting the peripheral nerves. These diseases occur when the immune system mistakenly attacks the nervous system. Examples of autoimmune and inflammatory neuropathies include Guillain-Barré syndrome and chronic inflammatory demyelinating polyneuropathy, CIDP. To diagnose these conditions, doctors assess the patient's symptoms, conduct laboratory tests, and sometimes perform nerve biopsies. By analyzing specific antibodies or inflammatory markers, medical professionals can determine the presence and severity of autoimmune and inflammatory neuropathies. These diagnostic measures help guide appropriate treatment strategies for patients with these conditions. Hereditary and genetic neuropathies are conditions that individuals can inherit from their parents, which affect the peripheral nerves in the body. These disorders have a specific set of symptoms and can be identified through genetic testing. Examples of these conditions include Charcot-Marie-Tooth disease and familial amyloid polyneuropathy. In managing these disorders, it is essential to take a comprehensive approach that includes various medical professionals and focuses on alleviating symptoms, monitoring the progression of the disease, and offering genetic counseling to patients and their families. Metabolic and toxic neuropathies arise from various systemic conditions and exposures to toxins or medications. Diabetes mellitus is the leading cause of metabolic neuropathy, while exposure to heavy metals, certain chemotherapy drugs, and excessive alcohol consumption can result in toxic neuropathies. Identification of the underlying cause and appropriate management are vital for symptom improvement and prevention of further damage. Paraneoplastic neuropathies are uncommon neurological complications that arise due to an immune response triggered by an underlying cancerous growth. These neuropathies can occur before the identification of the cancer itself and can serve as a key indication for detecting an underlying tumor. It is crucial to promptly recognize these neuropathies, perform a thorough investigation for cancer, and administer immunotherapy to achieve the best possible outcomes in such cases. Small fiber neuropathy primarily involves damage to the thinly myelinated or unmyelinated nerve fibers responsible for pain and temperature sensations. Patients with this condition may experience sensory disturbances, autonomic dysfunction, and chronic pain. Diagnosis involves specialized tests such as skin biopsies and autonomic function testing. Management includes symptomatic treatment and addressing the underlying cause, if known. Infectious neuropathies are a type of peripheral nerve damage that can occur due to infections caused by viruses, bacteria, or parasites. Some examples of these infections include Lyme disease, HIV-associated neuropathy, and leprosy. To accurately diagnose these conditions, it is important to perform laboratory testing and serological assays to identify the specific infection. By doing so, healthcare providers can start targeted antimicrobial therapy and effectively manage any complications that may arise. In the field of peripheral neuropathy research, scientists are actively investigating new treatment options and working to gain a deeper understanding of the underlying causes of this condition. Recent advancements have focused on emerging therapies such as gene therapies, regenerative medicine, and neuroprotective agents. These innovative approaches hold great promise for the future of neuropathy treatment. Additionally, the rise of precision medicine may lead to personalized approaches for managing neuropathy, tailoring treatments to meet the unique needs of individual patients. Exciting times lie ahead for the field of peripheral neuropathy research. Peripheral neuropathy encompasses a broad spectrum of neurologic disorders that significantly impact patients' lives. Through a thorough understanding of its clinical manifestations, diagnostic approaches, and treatment modalities, healthcare professionals can provide optimal care to those affected. Moreover, ongoing research holds promise for novel therapeutic options, instilling hope for improved outcomes in the years to come.